Hurricane Katrina took away so many things that made up the fabric of our lives.
I was a nurse at Tour Infirmary when Hurricane Katrina hit. What I saw during and after the storm made me realize that our community had to totally transform the way we delivered health services. Our patients had so many needs beyond their health issues. We knew that if we were truly going to reach people, we needed to find a new way.
New Orleans has a proud history of providing health care to the indigent. Charity Hospital, founded in 1732 to provide care for the city's poor, is the second oldest continuously operating hospital in the United States. Prior to Hurricane Katrina, Big Charity was the source of care for most uninsured individuals. Doctors and nurses at Charity provided world-class care, but the centralized model of service delivery was inaccessible to many residents. So after the storm, the commitment to serving all patients regardless of their ability to pay remained. But leaders from across the community came together to envision a new patient-centered health system.
New Orleans is a city of neighborhoods. For many New Orleanians, where you live is where you do most things. Going out, going to the store, visiting with friends and family. After Katrina's, leaders here realized that services had to be located in neighborhoods throughout the city.
Since 2005, New Orleans has transformed the way it delivers primary care services. Today, a system of neighborhood-based community health centers is thriving with 54 sites in the city offering primary care, mental health, and other services. So all of these clinics provide the services regardless of a patient's ability to pay. But sustaining these clinics is hard work, and it wouldn't be possible without NOCI, the Greater New Orleans Community Health Connection.
The Greater New Orleans Community Health Connection is a Medicaid waiver that provides primary care and behavioral health services to 56,000 residents of our region. We refer to this as the NOCI waiver, and it was originally started in 2010 as a way of providing support to a network of community clinics that have flourished in the post-Katrina era. Since then, the program has been extended several times because it is such an important program to our area. In many cases, NOCI, as well as the Affordable Care Act, packaged together, provide coverage for the backbone of our city, the culture bearers of our community, such as our musicians.
As a musician, having health insurance is really important to me. If I'm going to give my all on the stage every night, I got to be healthy. That's why I regularly visit the musician clinic. They have all the services I need. If I didn't have coverage, I might not be able to see my doctor like I do now. I love the doctor I see at the musician's clinic, and having coverage helps make that available for me.
NOCI makes available valuable services to 56,000 residents of the Greater New Orleans area who otherwise would be uninsured. But we know that increased coverage throughout these programs is not having the full impact that it should have. For example, we know that almost all of the NOCI enrollees have had a clinic visit, but many have not been seen in a clinic in the past 18 months.
For us, health access is about more than health coverage. Getting people covered is half the battle. If we truly want to improve health outcomes, we need to make sure people know how to use their coverage and how to access the great clinics our community has.
That's where the City Accelerator comes in. As a city, we want to leverage data and analytics to ensure that all of our residents are taking part in our community's revival. From murder reduction to blight, we've achieved results by using data to provide better service and engage our citizens. Now, with the city's Accelerator's help, we want to extend that effort into healthcare. Using data and innovative techniques, we want to engage our city's most vulnerable populations to ensure that we have a healthier city.
The issue matters for New Orleans, but it matters for cities across the country as well. The Affordable Care Act has brought the biggest coverage expansion our country has seen in generations. But that won't improve health outcomes if the newly insured are not being seen by a provider. Cities everywhere need ways to make sure that the expanded coverage truly yields expanded access, that those with coverage are in fact seeking care.
Since Hurricane Katrina, New Orleans has been a leader in developing innovative solutions to once intractable health issues. This is a chance for our community to do that again.
Hurricane Katrina was a great tragedy, but the storm opened our eyes and gave us a chance to envision a new future for our city. Now we're building back New Orleans, not as she was, but the city that we always wanted her to be. Today, New Orleans is the nation's leading laboratory for social change. We're testing innovative strategies to improve the lives of our citizens and setting an example that other cities can follow. But we need your help. With City Accelerator's assistance, we can make a real difference for our city, for our health outcomes, for our clinics, and for the people of New Orleans.